So Kevin Henry, editor-in-chief for Dr. Bicuspid. Thrilled to be joined by Chanda Chatham, who is the Stericyl line manager and director of marketing strategy for Solmetex. So glad you're with me today.
Thank you, Kevin. Happy to be here.
And I'm thrilled that we're going to talk about Fast Check 15 a little bit today. So I want to know, first of all, what was the genesis behind the creation of this product? What was Solmetex really trying to do for the dental industry?
The industry is very confused with a lot of different IFUs, and testing is a big portion of it. You don't know if your water treatment is working without it. A lot of the tests on the market have been, they have a lot of lead time between when you conduct the test and when you get the results. Fast Check 15 is a 15-minute test, so it will help the practice know if their water is safe, same day, any day of the week, in just 50 minutes. We just want to help the practices test more often and not be afraid of it. It's very simple and easy.
You know, and one thing that I hear from dental assistants who are coming into the industry, and they're learning dentistry on the fly, and a lot of times, and infection control falls under what they do so often. How does this help some of those new team members who are coming in really understanding what infection control is in the practice?
It's a lot to handle. Infection control, reading all the different IFUs, right. A lot of the products don't work together. So the design behind this product was to make it really simple. If you've ever taken a COVID test, you know how to take this test. It's that simple. It's a strip. It's a one-line passing, 2 lines, fail. Easy to read. Not a lot of things to do clinically with it. You just sample the water and put it in a little vial and let it sit for 15 minutes.
I think a lot of times this is an out of sight, out of mind thing whenever it comes to dental unit water lines so often. So it's, in my opinion at least, it's nice to be able to know that something is taken care of so you can focus on other things in the practice.
Correct. Yep, that's exactly right. We want the practice to focus on dentistry, focus on their patients. They shouldn't have to think about whether their water is safe for their patients and themselves as well.
So one thing that I'm going to ask everybody today, and I want your opinion on this, is what is one of the biggest mistakes that you see with dental unit water lines that are right now in our industry that you're hoping to solve with this?
I think the misunderstanding is I have treatment in my bottle, so I'm good. I don't have to test the water. I don't have to shock the water. I don't have to do anything else. But once it hits those water lines, the chemistry can change. So the test is really the best way to make sure that the treatment is actually safe for the water in the water lines that goes to the patient.
I want to go back to something you just said because I think water is different everywhere. And understanding that and understanding the kind of water that you have in there is such an important part of making sure your water lines are clean and safe as well, right?
Absolutely, yes. Stericyl has 2 silver ion straws. They're based on the total dissolved solids in the area, and they're formulated for municipal water or distilled water. Some areas have poor water, and you have to remember it comes from a plant, it goes through the city pipeline, it comes through the building pipeline. All those are factors that can change the chemistry of the water. So once it gets to the practice, you test it for those total dissolved solids, and you select the correct silver ion straw that matches that and make sure that you have the most optimal water treatment.
Is this something that dental practices can use, dare I say, as a marketing tool to remind their patients they are taking care of them every day to make sure that, because we hear the horror stories and we know patients can get a little worried whenever they come into the practice as well.
Yes. I think with the water sources being depleted in our country and in the world, more people are paying attention to it. And so it's a great marketing tool. I personally, as a patient, would want to know how they're taking care of their infection control. We've all been in that chair, water splashing everywhere, it's splashing on them, and you're thinking about, wow, is that water really safe? And just by looking at the practice, it could be beautiful, it could be fancy, it could look sterile, but the water, it's a different story. So I would want to have that. It would be a great marketing tool rather than just picking a dentist that's down the street from me because it's close. I would want to know that they're taking care of the water that I eventually will come in contact with.
And like you said, the practice can be beautiful, but you don't ever see those pipes that the water is coming through.
Don't see the pipes. I often say if the pipes were clear, we'd probably clean them out more.
That's a good point. Absolutely. No, it is a great point. So I know this is launching here. What do you hope comes of this in the next 6 months to a year, and that this is something that dental practices obviously engage with and start using in their practice?
Right. I see this product 2 ways. It's an awareness product. It's people have not tested and they maybe been afraid of, well, what happens if I fail? There's all this protocol. There's all these things that I have to do. I don't have time. I'm running from operatory to operatory. I don't have time to wait for something to take 3 days or 5 days or even overnight to get results. This is going to change the game, honestly. It makes it so easy for them to do it. They could set a test up and go to handle another patient and come back in. It's non-invasive. And the other thing is just making sure that more people test that because it is simple. That awareness factor and the education behind it makes everyone safer.
I just kind of want to put a bow on this because I think dental unit waterline safety is such an overlooked part of the infection control protocol in the practice.
Yes.
And I think sometimes it's because it isn't in our face as much as sterilizing the instruments or whatever else we may be doing on a daily basis.
Correct. That's very true. The water isn't in the pipe. It's in the pipelines and it's in the water lines, but it does end up in your face.
Yeah, absolutely.
Eventually, right? But you're absolutely right. We think about the surfaces around us that we have to wipe down, sterilizing equipment, doing the autoclave, just all those clinical pieces. But water is something that the practice uses every day and is required. For all dental procedures. It really is a coolant for all those hand pieces. So water is an essential part of the practice and it should be well cared for too.
Chanda Chatham with Solmetex. Thank you so much for hanging out with me today. I appreciate it.
You're welcome. Thank you.